Hey everyone, my name is Dr. Dolores Tarver. I'm a licensed psychologist here in Georgia, and it is time for the TT Time with Dr. Tarver is a wellness-based podcast. It is not intended to be a substitute for a relationship with a licensed mental health provider. So, hey, we're back. It's May. I know. Mental Health Awareness Month. You're as excited as I am. I can tell. As we discussed last week, I was getting my wellness on, and so I skipped the episodes the first week of May and hit you with double episodes last week to catch up because this is how we do it, right? So we have been talking in this series about things that impact mental health and our mental wellness. And on Monday of last week, we discussed the reasons people struggle to address their mental health and because of that have difficulty consistently investing in their mental wellness because those go together. And then on Tuesday, we discussed the process of being just overly accommodating to people, overextending ourselves, overpromising and under-delivering, as they say in the military, which has just had a negative impact on our wellness as well. And then today, we're actually going to get into some of the genetics on mental health. So I was at a wonderful outreach, women's wellness event this past Saturday. And one of the participants asked, so is there a genetic component to depression? Well, I was all over that. I can get a little long winded. I'm going to keep y'all short today. I'm going to try to stay focused. Stay focused, girl. But it led to a perfect, I think, segue into today's topic, which is where does some of the mental illness come from? Is it genetic? Is it environmental? Is it social? Like where exactly are we getting the mental illness from? And why does it feel like we have more mental illness now than we did before? So first, let me just tell you that it is not necessarily that we have any more mental illness because I know there's a lot of theories around vaccinations and their impact on autism and what we're eating and some of the environmental changes that are happening in our water supply, our food supply, additives, all of these things. Are we seeing more mental illness because of that? And I will tell you that the answer really is not quite that simple. Like we recognize that there was, mental illness around about the same level previously, but we have instruments that are more sensitive. We have diagnostic tools that have changed and updated. Now we look at autism spectrum disorder, as opposed to some of you may have been aware of Asperger's being a diagnosis and then autism being a separate diagnosis. And if you watched Sheldon, if you saw any of his show when he was a kid, or when he was with the rest of his friends, then you associate that with that high functioning autism spectrum disorder, or back then Asperger's, right? So we've moved a little bit in that. We've Schizophrenia is now on a spectrum, and so we're looking a little differently at how we classify disorders and the factors that we include in that diagnosis. And yes, we are more aware of the environmental factors that are going around. We know that the ozone layer is depleting. We know that there have definitely been cities who have been affected by runoff from factories. We know that the water has not been suitable in a lot of cities whenever there has been significant impact to the infrastructure of a city and their water supply has been damaged. Come here, Detroit, come here, Jackson, Mississippi, then we know that that affects people and their ability to be able to access clean resources. We know that there are food deserts where people don't have access to healthy and nutritious food. We know that the increase in everything affects people's choices. We do know that the more preservatives there are in things, the more of the impact that is going to have on us. And I know you have seen the studies, like I have seen the studies. Every week it seems like it's something different. Now they're talking about chicken and how chicken affects our ability to be at risk for cancer and some other things. They're looking at um, preservatives and how it could potentially set us up for Parkinson's, our cognitive challenges. We have been told that those dyes in food colorings can lead to different health problems, particularly those related to how our young people develop and how they function. And so, is there some truth to that? There's always some truth in some things. Now, is it as prominent as what the articles say? Not necessarily, because you do have to get into who was the study conducted on, and they talked in that chicken study about, hey, was it fried, was it baked, was it right? And so this kind of information is important. We have debunked that vaccines are responsible for children being on the autism spectrum. However, we also recognize that there is absolutely a genetic component to five disorders, which is why they are very closely related. So, the National Institute of Health actually did some research, and in 2013, an article came out entitled Common Genetic Factors Found in Five Mental Disorders. What are those? I've referenced a few of them already: autism, ADHD, so our attention deficit hyperactivity disorder. And just to be clear, there is no ADD, there's just ADHD. You're inattentive, you could be hyperactive, impulsive, or you can have combined, which is both the inattentive type and the hyperactive, impulsive type. Then bipolar disorder, major depressive disorder, and schizophrenia. And if we think about some of the characteristics of this disorder, they present very similarly, right? The mood fluctuations that you see present in all of them, the way people organize their thoughts, how they interpret information around them, their ability to manage and control their frustration tolerance, their impulsivity, their ability to be able to deal with difficult things, their problem solving, the ability to get stuck, as we say, and perseverate around different things, right? Like all of those things are related. And so that absolutely would explain potentially why their presentations can have those overlapping symptoms. And for those of us that do diagnosing, it can absolutely make it a little bit more challenging sometimes to tease out what is causing the presentation. Now, we cannot predict who will end up having these disorders. These are just what we call correlational information. So we know that there is a genetic component. We see that the patterns, but it doesn't necessarily mean at your birth we'll be able to tell whether or not you'll have these criteria if you already have a first degree biological relative with one of those conditions. However, we do recognize that does increase your chances. Things can skip generations. Sometimes things will affect males differently than they affect females. There are a lot of protective factors that can go into that. So there's a lot of information that we're still figuring out. However, that is helpful to us in terms of being able to figure out how to better mitigate symptoms. None of those are curable. But what we can do is manage the symptoms better and learn strategies to be able to help individuals who have been diagnosed with those conditions to be able to navigate life a little bit more effectively. We also know that mental illness is complicated. As I mentioned earlier, there are the genetic and biological components, but there are social, personal characteristics or psychological characteristics. There's financial, there's environmental determinants or exposure to different things. We recognize that there is a trauma, intergenerational trauma theory, that trauma is inherited because there are genetic changes to a person's DNA when they experience prolonged trauma. And we've talked about the impact of trauma. We've talked about the impact of long-term stress in previous episodes. And the changes from trauma don't necessarily damage the gene, but what they do is they affect how the gene functions, how we respond, how we navigate. And long term trauma can produce intrusive memories, a pattern of avoidance, negative changes in thinking and mood, changes in how we react physically to stimuli that comes in, as well as emotionally. And we also recognize that we got into this a little bit when we talked about food deserts, when we don't have access to things. So, whether you have experienced neglect, you didn't have enough resources to have stable and consistent and clean and safe housing. You didn't receive emotional nurturance and support. Your parents weren't emotionally available. A lot of negativity and criticism in your background. People didn't deal with things. You were told to be seen and not heard. Or perhaps there were a lot of things going on in your family. And you learned to navigate by trying to stay out of the way, right? Which is when we start to develop some of these patterns. These are the personality characteristics that I was alluding to earlier of like, I don't want to be the problem, the people pleasing, the accommodation we talked about last week, being more susceptible to higher levels of stress, having difficulty being able to navigate stress, or being more prone to not trusting people and being more difficult, taking things more personally, being more prone to attacking other people, having difficulty in relationships, the things you saw modeled. Anxiety is one of those things that we also can pass down. You may have grown up with a parent with some obsessive compulsive disorder tendencies or traits. And so there had to be order. You may have grown up with somebody who's military family, right? The structure and the order. And so it upsets you when things aren't in order, when there's changes in things. You might be very rigid in the way that you approach and think about things. Exposure to drugs could affect you in a lot of the different ways that we talked about in those other diagnoses. So I think that there's no simple answer, but what I will say is a few things, right? As I like to say, as I get ready to land my plane. One is that it's important for you to understand your family history. I cannot underscore enough how important it is to ask those questions. And I know that some of you have family members who are not going to be telling you about schizophrenia and bipolar disorder, but you can ask questions about behavior patterns, right? Like, oh, did I hear Auntie was a little, she was getting real upset when people would move stuff? Yeah, she did not like things being out of order. Ding, ding, ding. Okay, anxiety, maybe some obsessive compulsive. Yeah, I heard she used to be in the room and they would wonder who she was talking to and wasn't talking to anybody. Yeah, she talked to herself all the time. We were like, no, what's going on? You know, she went to the hospital. She had a little breakdown after her husband died, right? Okay, so now we got some history of some prolonged grief, possibly some schizophrenia, possibly some bipolar disorder. Yeah, I heard she used to be all over the place. Yeah, you ain't know who you was going to get. And don't let her get to drinking, right? Now we checking off some characteristics of, okay, might have been some substance use in there. Might have been some bipolar, might have been some schizophrenia, right? So you can assess in other ways, talk to multiple relatives, talk to relatives who are much more likely to be able to share these things, find out about your cousins, right? Some of us were adopted, and so it might be a little harder for you to get that information, but you can start from where you are and try to gather information. Look at your children, gather information so you can begin to build that family history, even if you have some parts missing. Number two, what I will say about why understanding the components is important is because it allows you to be able to better understand your risk factors. Some of us have significant addiction potential in our families. And so you will be the person that you might use it and get addicted. Somebody else might use it and they don't use it again, or they use it for a period and they never use it again. For you, you'll get addicted and find that you will transfer your addictions to multiple things. It could be people, it could be gambling, it could be food. Be substances. So you really want to understand so that you can set yourself up. We always say prevention is better than intervention, and early intervention is going to be your best type of intervention, so that you can make sure that you're allowing yourself to be able to navigate these challenges in the event that they come, but also to help set your kids up, because you're wondering like, hey, like people start having psychotic breaks around late adolescent and lessons. And so we want to make sure when you're experiencing symptoms, particularly if you go off to college, you go into the military, you're pursuing something, that we're checking in. Also, three, I will tell you that it's very important for everyone to have a mental health provider. You may not need them right now, but you are going to need them at some point. And so you definitely, you know, you was going to get your plug for counseling now. You definitely want to go ahead and start that process so you have someone lined up when there's a transition. You're going to be going from one environment to a different environment. There's a grief and loss, right? Because what you don't want to be doing is scrambling around trying to find a therapist when you need one. And then, you know, it's hard to find a therapist and a good match. So you have to do your research. You might have to do some consultations with some people to make sure that you're finding a provider that's a good fit for you. The other thing I will say is track your symptoms. So if you, and a lot of times we don't even understand what we're experiencing because we've normalized it, but if you're having problems sleeping, your gut health is always upset, you got a lot of tension, neck, shoulders, and back, hair falling out, irritable moods, going in a lot of different places, distracted, hard time focusing, completing things, unmotivated, don't have a lot of energy and effort that you feel to get things done, constantly having things on that to-do list that don't get completed. That's that good symptom tracking. So when you go for your monthly wellness appointment, monthly, yearly wellness appointment with your physical health provider, your PCP or whoever you may be seeing, then you can talk with them about those things because they may be able to refer you for some additional evaluation or assessment, or be able to do some consultation to see if there may be some other things going on, right? So there are a lot of reasons how we get here. Sometimes that's less important as what we do once we figure out we're here. All right, so stay on top of your mental wellness. Make sure you're tracking, getting those appointments scheduled, and taking care of and attending to your wellness. All right, everybody be well.